non-medical cannabis was legalized in Canada in October of 2018. And there are important public health benefits from legalization, and that's primarily from reducing harms from criminal records. But there's also real concern that legalization, and in particular commercialization, where you create a new retail cannabis industry, can increase cannabis use and harms. And the aim of this research was to track how healthcare visits related to cannabis changed after legalization. We did 2 studies capturing all emergency room visits in Ontario using administrative data from ICS. We identified visits due to cannabis using billing codes and diagnostic codes, and these visits were primarily due to poisoning, addiction, dependence, and cannabis-induced psychosis. And we looked at the changes in visits over 3 different periods: pre-legalization, legalization in Ontario when there were very strict controls on the number of stores and the types of products that could be sold, and then a period that I call commercialization, when the cap on the retail stores was removed and new products like cannabis edibles and cannabis-infused beverages could come to market. We looked at 2 different populations: children aged 0 to 9 years and adults. And I'll start by talking about our findings for the young children. So overall, there were a total of 512 emergency room visits in kids aged 0 to 9 over a 6-year period. Pre-legalization, you see 2.5 visits a month. In the first phase of legalization, with no edible products and limited numbers of stores, that went up by 3 times. And then during the period when the commercial edible products came to market, it increased by 9 times compared to pre-legalization. And there were some markers that the severity of visits went up to, from 24.7% pre-legalization to just under 40% at the end of the study. For adults, we saw that there were 67,000 emergency room visits due to cannabis in people aged 15 and older. And over the 6-year study, it tripled. You go from 555 visits in January 2016 to over 1,600 visits in May 2021. So the findings are showing us that there has been a very large increase in cannabis-related emergency room visits since legalization across a variety of age groups. They suggest that legalization with strict regulations and retail controls doesn't seem to cause a large increase in visits. But in contrast, commercialization with expanded stores, new products, that seems to increase cannabis use and related harms. There are some very important limitations to this study. The COVID-19 pandemic occurs and overlaps with a large portion of the time post-legalization, and it's challenging to isolate out pandemic or industry expansion effects. We also don't know whether some of the exposures in young children are from illicit products, and it's likely that many are, and I think further research needs to tease that out. Almost all research to date on the health impacts of legalization has focused on the first year, when there were very limited numbers of stores and a very immature market. And those studies have not found big changes in cannabis use or health harms. And consequently, I think that most Canadians see legalization as having not been a big deal, and that the public health concerns surrounding it were really overblown. But our research is suggesting that while these initial studies are correct, legalization without commercialization doesn't seem to cause major changes in cannabis use and harms, that commercialization can really increase some of these harms. And we see that in the years 2 and 3 and later years after legalization. I think that policymakers and regulators need to understand that Canada's experiment with legalization is not finished. And if more data accumulates showing that there's been increases in harmful cannabis use, we need to be ready to more strictly regulate the market.